All right, so this morning I'm really excited to introduce our speaker, Dr. Thomas Hale. Dr. Hale is currently an associate professor of global public policy and the director for China engagement in the Blavatnik School of Government at the University of Oxford. And he holds a PhD in politics from Princeton University, a master's degree in global politics from the London School of Economics, and a Bachelor of Arts in public policy from Princeton's Woodrow Wilson School. Dr. Hale's research explores how we can manage transnational problems effectively and fairly, trying to explain how political institutions evolve or not to face the challenges raised by globalization and interdependence, emphasizing environmental, economic, and health issues. And he's written a number of books on the subject. There are four of them that I found. So one of them is called Gridlock. So why cooperation is failing when we need it most. Between Interests and Law, the Politics of Transnational Commercial Arbitration, and then Transnational Climate Change Governance. And then a recent book called Beyond Gridlock that tries to identify systematic means to avoid or resist the forces that are contributing to global inaction and finding collective solutions to these problems facing our time. Similar to many of us, his work has shifted to a large focus on understanding COVID-19. And in that respect, he's been leading the Oxford COVID-19 Government Response Tracker initiative, which is an effort to systematically collect information on several different common policy responses that governments have taken to respond to the pandemic on 18 indicators, such as school closures and travel restrictions. And they've collected data from over 180 countries. So it's a huge volunteer effort. And as Lauren mentioned earlier, our group is working to start helping to actually try and collect fine-grained county level policy data in the United States to better understand how the policies are impacting the pandemic. And he's got a number of publications analyzing the government response data, but I don't want to spoil any of his results because he'll be talking about the variation in government responses to the pandemic today. So the floor is yours, Dr.
Thank you very much, Spencer, and thank you everyone for inviting me to join you today. It's great to be part of, see a bit more of how you work as a group, and we're super excited about working together on the county level data collection. That's going to be a really exciting next step for our project, and I hope will be fun for you guys as well. So that's great. I'm just quickly share my screen so I can share a few pictures. Do let me know if this is working. Can you see that now? Great. Let's see if I can make it full screen. Actually, that seems to be showing presentation mode, doesn't it? Let me just make it big.
No, we could, I think it was looking fine. It
was looking fine? Okay, sorry.
For us.
Great, I will do that.
Yeah, maybe.
Great, so I want to start this with a kind of somewhat controversial proposition, which is that actually my view, and I think it's that the most, or maybe certainly one of the most important factors in determining success against COVID-19 hasn't been the strength of a country's health system, how well the plans it had in place were to start with, but rather how effective policy responses have been and how effective political leadership has been in mobilizing policy responses. And that's quite interesting to me because it really makes us rethink a lot of the ideas that we have as political scientists, that's my discipline, on what state capacity is, what makes some countries good at doing things for others. And I think we've upended some of that conventional wisdom in the last year. There's an influential ranking of countries' preparedness for pandemics that was put out in 2019. The first country on that list was the United States. The second country was the United Kingdom. I think probably those examples suggest that this is not necessarily measuring exactly what has been most influential. So understanding why governments do what they do and what effects policy has is, I think, a really important part of this response, but also part of building up a better, if you will, immune system for the body politic, a kind of effective public health, public management response for these issues going forward. So the Oxford Government Response Tracker is trying to do that systematically across countries and across time for a whole different range of government policies. And we're really trying to think about mapping that to answer two critical research questions. One is, what leads government to adopt different policies? Why do governments do different things? And secondly, of course, what effect do these policies have on the spread of the disease, on populations, on different outcomes of interest like the economy or mental health or other kinds of things that are interesting and important. And how do those effects, of course, vary across different kinds of places, people, contexts, etc. So today I just want to give you a quick overview of what the project has been doing so far and to say one word about each of those two major research questions. And we'll try to keep it very short so we can have plenty of time for discussion. So the project's approach is very much a sort of citizen science-based approach where the information we collect is driven by this great big global team of volunteer contributors, volunteer data collectors who are trained, who are part of our team, but who are really contributing their own time to this effort because they see it as a way to contribute to a broader public good. So that's really the heart and soul of the project. But that team collects information on, this slide says 18, but actually it's now 20 different indicators of government response. And they're listed there on the right-hand side. They cover 3 different areas: closure and containment policies, which you might call lockdown policies of different kinds, but also economic support and different kinds of health system policies like contact tracing or testing. And for each of these, we record not just whether governments are doing something on that or not, but we put it into a broad ordinal scale. In other words, we say it's at what degree of intensity that policy has in some sort of common sense ways. So for example, we might say for school closings, is there no restriction? Is there a recommendation to have some limitations on school closing? Is it fully closed across all levels, one level, etc.? So it kind of to give you a degree of a sense of the degree of the policy as well as the presence of the policy. And as I said, we're now tracking nearly every country in the world and a growing number of subnational jurisdictions. Currently, the United States, Brazil, UK, and Canada at the state or province level, and are now working to include India and China, and very excitingly, soon to move down to the deeper level of counties in the US in collaboration with all of you. And the most important point about this is that all of this data collection is done in real time to try to keep a really up-to-date source that's immediately available to publics, to researchers, and to policymakers, so that we're able to maximize the use of the data. So that's a really quick sense of what we're doing, but let's just see what that's been telling us so far about this first question. Why do governments do different things? What kind of variation do we see? And of course, there's been a lot of speculation about this in the media, but also a lot of increasing numbers of rigorous studies that are trying to answer this systematically. And some of the main questions that have been, or sort of hypotheses that have been put forward, have been around things like, is a country a democracy or an autocracy? Is it rich or poor? What's the political orientation of the leadership? Does it have male or female leaders, as been suggested as one potential explanation for differences in policies? Does the population have high trust in the government or not? Do people support scientific solutions, or are they suspicious of scientific solutions? All those different factors have been looked at fairly rigorously now. And interestingly, a lot of those results are, just to broadly generalize about the literature, fairly inconclusive actually. We haven't found, this is the one thing where all countries like this do it this way, all countries like that do it the other way. And just to kind of demonstrate that, there's a lot of speculation that more populist political leaders, for example, maybe less trusting of science, maybe more unwilling to accept restrictions on short-term economic outcomes, and so have been more resistant to lockdown policies. But if you look across the different more populist leaders in the world, compare Donald Trump, Bolsonaro, Duterte in the Philippines, Orban in Hungary, Modi in India, you find very different responses actually. So even though there are some common patterns, there's also a lot of differences. And for every rule, you can find a number of exceptions. So these kind of systematic relationships don't seem to be as binding as maybe was initially thought. Of course, there are some generalizations that tend to hold on average. So for example, here's a short look at US states by the political orientation of those states. And you can see pretty clearly there's a difference in the degree of, this is our containment and health index, so a measure of a whole range of different response measures. You're seeing more response measures in states that either have Democratic governors or states that voted for Clinton in the 2016 election than those that have Republican governors or who voted for Trump in the 2016 election, which I think we all understand and makes intuitive sense. But the point I wanted to make with this graph is actually not so much that that difference has now exists, is that it's actually changed over time. So if you look at the early phase of this, of the pandemic in the US, the differences were quite small actually across countries in the first months. And only later, when it became more politicized, did these differences begin to expand. And that's, to my mind, the kind of really interesting question about how to understand variation in government responses. We shouldn't see this as sort of a static issue where all governments that are like this do it this way, all governments that are like that do it that way. Rather, we should see it as a process that unfolds over time. And just to reinforce that point, looking across the national data, this is a set of heat maps that show every country in the world from the start of the pandemic till now. And the heat bar shows you their degree of their containment and health index. So basically how many lockdown and health policies do they have and how intense are those policies. And each row here is a different country. So you can see by looking across the row how a country's policies have changed over time. We've divided them into 4 different regions of the world. So as you can see—
What are the circles in there?
So the circles are the time that country experienced its 10th death. So this is a kind of crude measure of how, when a country was affected by a sort of significant degree of spread of COVID. As you can see, the red lines, the start of the red lines, lines up pretty well in the same sort of 2-week period, which falls between those 2 vertical lines, 2 black vertical lines in the middle of March. That's when we saw news reports out of Italy. That's when the World Health Organization declared a pandemic. That's when Google searches for COVID-19 spiked around the world. So there's a lot happened at that time that made everyone sort of move in the same direction. But actually the spread of COVID was much more spread out across most regions of the world and doesn't really match particularly well to the policy response. So even though you might hope, and indeed the World Health Organization advice was for countries to ramp up measures in response to the degree of spread of the disease, what actually we see happening is a lot of herd behavior, really. That, of course, changes over the subsequent months. You see gray popping back up, and then in some cases going up and down across each bar. But the point here is just to say that government behavior tends to be not necessarily driven by the things you want it to be driven by, and also shows this sort of temporal dynamic. And I think that's important as we think about the sort of longer term management of COVID, because if a country's early behavior is an important indicator of what it might do in the future, then it kind of emphasizes the need of getting it right from the get-go. I worry we're now in a situation where certain countries that were more successful in the early time are sort of more able to retain more trust of citizens and are therefore able to give themselves more policy space to do more stuff, be it vaccination or new lockdowns if that's needed, or whatever the thing is that's needed. Whereas countries that were less successful in the early months lost a lot of that trust, closed off and shrunk the policy space available to them to take whatever public health measures are needed. And so looking at not just what kind of innate characteristics of countries or political systems drive them to, but how this plays out dynamically over time is, in my mind, a kind of key part of understanding the variation in government policies. Let me just close by saying one word about the effects that policies have. So the good news is that we can now point to a whole range of research that shows pretty clearly that policy tends to affect behavior, which then tends to be shown a few weeks later in cases, shown a few weeks later in hospitalizations, and shown a few weeks later in deaths. And I haven't put that here, but there's a pretty clear average finding across countries that causal chain from policy to death exists, although of course each of those steps has caveats and nuances and moderators on all those causal links. This graph I'm showing you here is just a quick sort of check of that, showing you over the whole world over time what the association between the different policy indexes are and mobility data, just the first link of that causal chain. to show you that, yes, basically, we're seeing a strong, consistent relationship here on average, although of course for any given country, on average is only a starting point, and we need to look much more in depth at how that is contextualized by various local conditions. But then what I wanted to emphasize here is maybe a sort of next step there. So we've been thinking about a lot about how people comply or don't comply with policies. That's become a particularly significant issue at the moment as we come across various long-term COVID responses, not long-term COVID, but long-term COVID responses having sort of negative effects on people. And what we think we've been trying to measure is what fatigue we see with compliance. So this graph tries to measure that across all countries on average. And what this is showing you is that same graph I showed you just before, the effect of policy on mobility, but how that changes over time. So the horizontal 0 bar here is showing the effect of policy on mobility, the estimated effect of policy on mobility on the first day that that strict measures were put in place. So basically in day 1 of lockdown, if you will. If you're going below the bar, you're dropping compliance below that. If you're going above that 0 line, you're getting more and more compliance than on day 1. And what we see is that for most of the physical distancing measures, things like restrictions on gatherings, don't meet in large groups, et cetera, that deteriorates pretty consistently over time, even though it does seem to reach a plateau down at the bottom. And that's worrisome because it sort of means that this kind of extreme measure governments have been using has a limited lifespan. It kind of works, a bit, but it's not something we can see as a permanent solution. I think, as we know, this is trying to quantify that.
Thomas, how do you get data on how much people are gathering? Is that co-location mobility data?
Sorry, yes, I should have said that. This is based on survey data. So this is based on a series of surveys carried out by YouGov and Imperial College London that were done across 35 countries. And why that sample is really good is because they did the same survey every 2 weeks for the time period, I think from basically March until November. So that's what you're seeing here. But the good news there is that the right side, panel B, is showing us that some of the more habitual kinds of less costly measures, in this case mask wearing, become more routinized over time. So even though people have struggled with some of the more costly or demanding sort of physical distancing measures, things that are more simple, like mask wearing here, but also, for example, washing hands or that kind of stuff, actually grow in compliance over time because they sort of become part of people's daily routines. So that's, I think, an interesting thing we're going to need to understand a bit better as we think about the future, where COVID may be a more regular feature of the broader diseases we face on an ongoing basis. So that's a quick point on the second question of what effects policies have. Let me just close with this. Looking forward, I guess my own view and what we've been thinking about in our project, we're really curious to hear people's views on this, is that we're kind of now in a situation where we're facing a global race. Can we keep the spread low enough to prevent the rate of mutation from overwhelming the rate of vaccination? In other words, if we have COVID spreading so widely that we're getting new variants all the time, and they're eventually going to reduce the effectiveness of our vaccines, is that going to outpace basically the ability of our defenses on the vaccination front to be deployed and developed and deployed? If we can get ahead of that curve, I think we'll be moving in a much better direction. If we don't get ahead of that curve, it's a much more grim one. So that's the race we're staring down at the moment. Thanks so much for listening to those observations. I'd love your thoughts and questions on these points or others about the project. And like I said before, really excited to be working with you all on this going forward. Thanks.